Dr. Dustin Kostescu was working at a prenatal clinic when the news broke and patient phones lit up.
And just realizing this overwhelming sense of loss of control over their lives.
Everyone talking about the U.S. Supreme Court's decision.
The concern around the rise of transnational anti-choice movements is a very clear one. So it's a signal that Canadians should not be complacent.
Worried about what it could mean for American and Canadian women alike. There are already abortion access challenges for Canadians, especially outside of major cities. Even a small influx of Americans seeking help here could overwhelm a healthcare system already overstretched.
We are dealing with constraints that we've never had before in terms of personnel, funding, and access to services. Patients might find that they have an abnormal pregnancy later than before because they can't access the diagnostic tools that they need.
Some worry about for-profit clinics popping up in border towns.
We don't want to be drawing doctors away from the public healthcare system to go into kind of a for-profit model to help Americans. And, even though we do want to help Americans, but so we're torn.
And there's a lesser-known issue. Late-term abortions after 24 weeks are rare, but very difficult to obtain here. Often, Canadians are sent to the U.S. While the states that offer them don't have trigger laws, they too could face an influx of patients.
That group of patients that is sort of missing from this conversation, right, which are patients that do have, fetal anomalies or pregnancy abnormalities. These are wanted pregnancies. People are making the difficult decision to say goodbye to their babies.
Anti-abortion groups applaud the decision.
It opens up a conversation that is much needed, and it also allows us to see where our leaders stand.
In Canada, we will always defend women's rights to choose and continue to work to expand access to the full range of reproductive and health and services across the country.
But we asked the government a number of specific questions. What are they doing about access to late-term abortions and how to handle a potential influx of Americans who may travel here, and didn't get any concrete answers. Abigail Bimman, Global News, Ottawa.